One of the most common questions that I get is about hair shedding. When it happens excessively or abruptly, sometimes it can be very distressing, especially to women. Hi guys, I'm Dr. Pham, dermatologist and PharmD. Today I'm going to answer the question of why your hair may be shedding excessively. And if it's happening to you, watch until the very end before you panic. Here are 5 reasons why this may be happening. Let's go. If you're experiencing excessive hair shedding in a short period of time, you may be going through something called telogen effluvium. Now, telogen effluvium is a non-scarring type of hair loss that's driven by an abrupt shift from the growing phase of your hair to the resting phase of the hair. To better help you visualize this, let me lay out the science. So in a normal situation, your hair exists in one of 3 phases. A growth phase where the cells are actively dividing. We call this anagen. It lasts for about 3 years and it determines how long your hair actually gets. It then proceeds to the catagen phase or the breakdown phase where these cells stop actively dividing and break down a little bit at the bottom of the hair and shifts upward in the hair follicle where it sits. This usually lasts for about 3 weeks. Then it shifts over to telogen, which is the resting phase, where the hair just kind of sits there until new hair grows and pushes that hair out. Now these hairs are kind of loose, so they sometimes fall out on their own. At any one time, even right now, most of your hair, I'm talking about 90% of your hair is in anagen or the growing phase. That leaves roughly about 10% in telogen. Normally we lose about 100 to 150 hairs a day, and you don't notice it because it falls out kind of sporadically. You find it usually on your clothes, on the bed, on the couch, on the floor. And when you experience telogen effluvium, the hairs that were previously growing will abruptly stop and prematurely shift over to telogen. As more hairs are synced up in the resting phase around the same time, it can produce a more dramatic effect of hair shedding. Most people experience this in the shower when they're washing their hair and all of a sudden they have a large clump of hair in their hands, or when they're brushing and all these hairs come out on the brush and you're getting more and more. And if you're more of a numbers person, then the telogen hairs go from about 10% of the hairs increasing to 20% or higher. That's double. So that's telogen effluvium in a nutshell. Now here's 5 reasons that it may be happening. Number 1, and the biggest thing, is stress. Whether it's from physical stress like an accident or an injury, physiologic stress from working too hard, or lack of sleep, or psychological stress from life, relationships, or grieving. Our hairs feel what we feel, and when it's too much for them, they say, "I'm out." Number 2, getting sick. Now, when you get an infection that really makes your body weak and your high fevers, your immune system is super ramped up trying to fight it, rapid hair cycling can occur. In fact, telogen effluvium is the most common type of hair loss that's associated with systemic illness. When the pandemic happened, many people got sick with COVID, and if they were lucky to make it, many experienced excessive hair shedding that happened a few months later. But it's important to know that it's not limited to just COVID. If you get sick for any reason, this can happen. Number 3, pregnancy. Now, pregnancy puts a lot of stress on the woman's body, especially all the hormonal changes that happen. Sometimes this is referred to as postpartum hair loss. This is particularly stressful for new moms because on top of having to take care of a newborn, you're dealing with the emotionally taxing experience of losing your hair, which can further exacerbate any pre-existing depression or postpartum depression that they may already be experiencing. Now I want to make a plug here for mental health. Moms, if you're feeling not like yourself, depressed, or things are just different, you're not enjoying things like you're used to, please talk to someone, anyone, because being aware of your mental health is very important. Talk to your dermatologist. We're here to support you and we'll get you to the right people that can help. Number 4, lack of nutrition. Your hair is made from rapidly dividing cells, and as you can imagine, they need a lot of nutrients to grow. Just like a lawn needs fertilizer and water, without these things, they turn brown and die. And the same with your hair. When someone has poor diet, either from lifestyle choices, fad diets, or an underlying medical disorder, they can have a protein or calorie deficiency, low levels of micronutrients such as vitamins, zinc, or iron. Getting a good balanced diet and optimizing these factors can be beneficial for your hair. Now, this does not mean that go take all the supplements that you can find. In fact, if you're not deficient, taking more vitamins does not help. What you should really do is go see your dermatologist and they can evaluate you and they will tell you if you need any additional tests. Number 5, medications. Now, any medication can cause telogen effluvium. This can be blood pressure medications, chemo, and sometimes even acne medications. But it's important that you don't stop any of these medications until you talk to your doctor, especially if it's a chronic medication. So if you think this is what's going on, just talk to your doctor, have a conversation, and see if there are alternatives that you could use in place of what you're already taking now. And those are 5 reasons why your hair might be shedding so much. Again, it's telogen effluvium, long word for rapidly cycling hair from a stressor. And I forgot to mention this earlier, but sometimes people don't experience this right away. It may happen 4 to 6 months after that trigger. But don't panic. All that hair will grow back in time. It may take 6 to 12 months, and that may seem like a long time, but as long as you can correct these factors, all of these hairs will grow back. Now, a lot of people have asked me, what can I do to make these hairs grow faster, or stop shedding, or stabilize the hair even? And the studies show that even using minoxidil, or Rogaine is a brand name, doesn't really help that much. It naturally will resolve on its own most of the time. Hey guys, I'm a dermatologist, but I'm not your dermatologist. So if you are experiencing any hair loss or any other hair issues, please call your dermatologist and have it looked at. I feel like the earlier we can intervene, the better the outcome. If you like the contents of this video and learned something, please gently tap that like button. If you have any questions, leave a comment down below or hit me up on social media at QFamMD. And consider subscribing because I'll be putting out new content every week, so don't miss it. Thanks so much for watching, and I'll see you guys in the next one. Bye.